Good afternoon, everyone. I'm excited to be here today to talk about how Alberta's government is continuing to address rural physician recruitment and retention. And I'm pleased to be joined by Dr. Gavin Parker, who is a family physician from Pincher Creek and the chair of the Rural Health Professions Action Plan, and Katrina Taylor, a student at the University of Calgary's Cummings School of Medicine and also one of the co-chairs of the Family and Rural Medicine Interest Group. As you know, getting enough physicians to rural areas of the province is an ongoing challenge, just as it is in other parts of the country. And COVID-19 certainly hasn't helped. But we are taking action to address this challenge on numerous fronts because we are committed to ensuring Albertans have equitable access to physicians no matter where they live. These actions are multifaceted and include things like investing $90 million this year into rural physician recruitment and retention, as well as having among the highest physician compensation in Canada. Part of the actions we're taking also include an innovative new program that I'm excited to outline today. It is a real solution that will get more doctors in rural areas starting this fall. The program will provide financial benefits to new family physicians who practice in rural Alberta. In exchange, these new family physicians will provide 3 years of service in a designated rural community. Alberta's government is proud to be investing $6 million over the next 3 years for the Reside program. In each of the next 3 years, 20 new family physicians will receive $2 million to start practicing in rural or remote communities of need. New family physicians will be eligible for $60,000 for undergraduate tuition fee reimbursement, as well as remote community incentive ranging from $20,000 to $40,000. The amount of community incentive will depend on the remoteness of the community where they are working. There are 15 communities that have been initially identified for eligibility in the first year of the program. They are as follows: Fox Creek, Grand Cache, Fort Vermilion, Wabasca, High Level, Rimbey, Lloydminster, Milk River, Cold Lake, Lac La Biche, Rocky Mountain House, Fort Macleod, Barrhead, Ponoka, and Athabasca. So a total of 60 new family physicians are eligible for incentives through the program over the next 3 years, with a new application process and further communities being identified in each year. This program is part of our commitment to address rural physician recruitment and retention across Alberta. It builds on experiences of other Canadian jurisdictions with return of service programs. So how do new family medicine physicians take advantage of the Reside program? Simply by applying online starting tomorrow. The Rural Health Professions Action Plan is administering this program. Applications will be open on their website at r-pap.ca. To be eligible, applicants must be a family medicine resident physician completing their residency training this year and express interest in practicing in rural and remote parts of Alberta. They will be asked to choose their top 10 communities and will then be matched to communities based on the best fit for available vacancies. Applications will be accepted until the end of March, and the first group of new family physicians will start practicing in these communities by this fall. I'm very excited about this new program. It will be instrumental in attracting new family physicians to underserved communities throughout Alberta. It will improve Albertans' access to the healthcare they need and will further our goal to ensure Albertans have equitable access to physicians no matter where they live in the province. I'll now ask Dr. Gavin Parker, a rural physician from Pincher Creek and chair of the Rural Health Professions Action Plan, to say a few words. Thank you. Dr. Parker?
Well, thank you, Minister. The launch of the Rural Education Supplement and Integrated Doctor Experience Program, or RESIDE, marks the arrival of a long-awaited opportunity for physicians who are just beginning their practice in rural Alberta and a chance to explore what it's like to live and work in these communities. The Rural Health Professions Action Plan is proud to have been chosen as the administrator of this exciting return of service program. For over 30 years, RPAP, as we're known, has supported the efforts of rural physicians to maintain, rural Albertans, to maintain an accessible health workforce close to home. Our demonstrated expertise in administrating support programs for present and future rural physicians and our role as a trusted collaborative partner for rural Alberta communities and Alberta medical schools makes us an ideal choice to administer the RESIDE program. Our dedicated team of rural consultants who serve in communities across rural Alberta will be working with local volunteers to ensure RESIDE participants are welcomed and integrated into their new homes. In addition, our housing team will help new physicians find accommodations, including 3 months of free housing while they get settled into their new communities. RPAP's outstanding continuing professional development programs will also be available to all physicians who participate in RESIDE. Having practiced in a rural Alberta community for 15 years, I can attest to the importance of providing a warm welcome for physicians who are new to practice in rural Alberta. The RESIDE program ensures that highly trained, talented physicians will have the best chance to establish a successful practice in the rural and remote communities that need them the most. Through RESIDE, and through the efforts of dedicated medical staff and volunteers in our rural and remote communities, we are hopeful the next generation of family doctors will enjoy the benefits of life and practice in rural Alberta and that I have loved and continue to love over these years. We believe the RESIDE program will play a pivotal role in attracting physicians to Alberta's rural and remote communities, and the launch of the RESIDE program demonstrates the Government of Alberta's commitment towards ensuring rural Albertans have access to health care close to home. So we're joined by Katrina Taylor and Peyton Sport, both co-chairs of the Family Medicine and Rural Medicine Interest Group at the University of Calgary Cummings School of Medicine. And I'll invite Katrina to come up and say a few words from the medical student's perspective.
I apologize, I shouldn't have worn hoops today. I wanted to thank Minister Coping and Dr. Parker for having us here today. I'm just one of the co-chairs of the Family Medicine and Rural Medicine Interest Group at the University of Calgary, Cummings School of Medicine. And while we do not represent the Cummings School of Medicine, we are a medical student group that focuses on promoting family and rural medicine amongst the student body. One of our goals for the year was increasing student interest in and commitment to rural medicine. We are very excited about the RESIDE program and hope that it can lead to accessible and high-quality primary care for rural Alberta. Access to primary health care is associated with lower mortality from cancer, heart disease, and stroke, and an increased life expectancy and perceived health. Simply put, having access to a family doctor saves lives. People in rural Alberta deserve access to high-quality, sustained, dependable, and comprehensive health care in their hometowns. Without such access to rural doctors, more patients end up in emergency rooms, which in turn backs into critical services, leading to poorer healthcare outcomes for patients and more expensive healthcare provision. Creating access to rural family physicians is a way to alleviate pressure within the healthcare system and to increase health outcomes while lowering healthcare costs. I myself grew up in southern Alberta in an area that has constantly struggled to find and retain physicians. So I'm personally aware of the palpable sense of insecurity that not having a consistent family doctor has on families, individuals, and the community. And I'm excited to see that my hometown health center was mentioned as a recipient of the RESIDE program, and I'm hopeful that this is an important step toward increasing rural healthcare access. Creating and retaining more rural physicians is indeed a multifaceted endeavor that requires significant, consistent, and longitudinal efforts. We are excited to be part of encouraging medical students to explore the many wonderful opportunities that are available within rural medicine in Alberta. It is our hope that this program will help booster an interest in and commitment to rural family practice within the student body and help graduating physicians connect and settle within rural Alberta. Thank you very much.
Well, thank you once again, Dr. Parker. Thank you, Katrina. Greatly appreciated. And with that, happy to take any questions.
Thanks, operator. We'll go to the phones for the first caller, please.
Our first question comes from Dean Bennett, Canadian Press.
Hi, Minister. I don't know how to phrase this except in a blunt way. Why should these recruits trust you? And by that I mean we're coming up on the 2-year anniversary of a government that unilaterally canceled the AMA agreement and still has on the books, as I recall, legislation that would allow you to cancel things at the stroke of a pen anytime you want. So what assurances, if anybody joined this program, would they have that your government wouldn't just change the rules halfway through at the stroke of a pen?
Well, thanks for the question. We are committed to ensuring we can provide equitable health services across the province. We've committed over $90 million in this year alone for rural physicians, and this program is just one example of us being following through on that commitment over the next number of years. I am pleased, and you may have seen that we have engaged in interest-based bargaining with the AMA that started last week. I am looking forward to the outcome of that process, and fully appreciate the need that we reach an agreement and we provide some certainty for doctors in regards to their source of income, so they can actually set up their businesses, and we are working very hard to make that happen for them.
Thanks,
Yeah.
Minister. Follow-up, Dean?
Yeah, I appreciate that, Minister, but I think, what the doctors have been calling for is that you repeal this, Bill 21? You repeal this legislation, because I appreciate your sentiments today and your comments, but it doesn't mean a whole lot if, at the end of the day, your government still has legislation on the books that can just cancel any agreement at any time. So will you commit today to repealing that legislation as a good faith gesture to doctors?
So we have made a number of good faith gestures for doctors as well, and very pleased to be working with the AMA. We have made some recent changes to the virtual codes dealing with stipends, and I'm really looking forward to the outcome of the process, interest-based bargaining. And then it's through that process that we'll be able to get certainty for doctors, and we'll see what the outcome of that process is in terms of how we proceed.
Thanks for that, Minister. We'll go to the next question.
Carly Robinson, City News.
Hi there. Thanks for taking my question. I would like to get Dr. Gavin Parker's perspective on this. And my question is about the last 2 years and what it's been like trying to recruit and retain. What are you hearing as some of the big issues? Is the contract being ripped up big on people's mind? Is it issues with other things? What are you hearing?
Yeah, thank you for the question. And as a full-service rural doctor, I can tell you the last 2 years have been tough. I mean, and I think most notably tough because of the pandemic that we have been dealing with. I think, as the minister explained, getting back to the bargaining table and achieving a new contract is a high priority for the AMA, and I think we've made some big strides in that regard. And certainly, as the minister mentioned, the new virtual codes and enhancements to those, and especially as they were available early in the pandemic, has been very useful. I myself have converted more than half of my visits with my primary care patients to over the phone service, which in particular with rural patients is very appreciated, right? So they're not having to drive down roads that may not have been plowed and maintained and things like that in big snowstorms like what we had today. So that's been a great advantage. It's been a challenge. I certainly agree that a contract would be a great move forward, and I'm confident that within the next while we'll have a negotiated agreement.
Thanks, Dr. Parker. Follow-up, Carmen?
Yeah, I was wondering if you could just illustrate a sort of what's happening in rural communities right now with the shortage. I reached out to my own family in Lac La Biche, and they say we're looking at over a month to see a doctor for regular things, and like the wait times are up. What else are we hearing in these communities?
Yeah, and so that's been a big challenge in, I think, most rural communities. I've had a number of my colleagues, that have left over the last few years. A lot of them have chosen to go back into specialist training programs or have chosen, work in urban communities. And I think with this program, and really what our goal is try to anchor people to those rural communities. I myself, I grew up in a bigger city. I grew up in Lethbridge and didn't really even think much about becoming a rural doctor until I got exposed to the opportunities through some RPAP programs. And I think this program will really help people. We know from evidence that the earlier and longer we can give rural students, and all students, whether medical students, nursing students, physio students, the opportunity to practice and work in rural areas, the more of a chance we have to recruit them long term. So it's not just about the doctor, but also about their families.
Thanks for that. We'll go to the next question.
Rick Bell, Calgary Sun.
Excuse me, sorry.
Good afternoon. I have a question on a different topic, though it's still about health. Question to the minister. What is your reaction to a poll released this morning by Angus Reid saying that a clear majority of Albertans want an end to COVID restrictions?
Yeah, thanks for the question there, Rick. I mean, just before I answer that, I just want to follow up on the previous question. Recognizing that there's a tremendous amount of work that we're going to be doing with the AMA in regards to a contract. Please note that the issue of challenges for rural physicians, particularly family physicians, is not an issue unique to Alberta. It is across the entire country, and we're focused on solving that. And this is just one small piece. To your comments, to your question there, Rick. In terms of my reflections on the survey, I'm not entirely surprised. Albertans, like all Canadians, are watching very closely what's going on with Omicron. We're seeing in Ontario, for example, the numbers have come down, and not only in terms of the numbers in the community, but hospitalizations have come down, and then conversations about, okay, now this has come down, and the purpose of these restrictions is to be able to protect our not only each other but our healthcare system, looking at potentially removing them. So I'm not surprised that people are looking at that. Now, as you know, Rick, we're a little bit behind Ontario in terms of the number of cases. Our cases are coming down. We haven't seen that reflected in our hospitalizations yet, although some initial data coming out over this weekend, we may be seeing a plateau. But again, there's still initial data, and we're going to have to wait and see over the course of the next week of where our hospitalizations are at.
Thanks, Minister. Follow-up, Rick?
Yes. Again, reacting to a news conference of just an hour or so ago from Premier Scott Moe of Saskatchewan, who, again, on the issue of restrictions, sounds like they're going to be lifting the vaccine passports, for lack of a better word, sometime in February. Originally, they were looking at February 28th, but the Premier of Saskatchewan said he might like to move that date forward, that is to say earlier than that, so sometime earlier in February. And of course, once that's gone, the question of other restrictions can follow. So what is your reaction to the fact that there are other provinces looking quite aggressively at changing the whole, story around COVID, whereas before it was grim story after grim story after grim story, and now we have various provinces coming out and talking about the beginning of the end. So where are you with that? And in line with that, how close are we to hospitalizations peaking?
Yeah, so in regards to your last question first, we're going to have to watch the data. We had some positive, like as indicated last week, our ICU numbers have plateaued. Initial data coming out of the weekend that we may have seen a couple of data points of our hospitalizations plateauing, but again, we're going to be driven by the numbers. This is extremely challenging time right now for hospitals, recognizing that as a system overall, we're still, under our capacity. However, I do note that in a number of locations, Edmonton, Calgary, for example, that they're over capacity. And I just want to take this opportunity once again to thank all of our healthcare workers for the tremendous job that they are doing in providing services in very challenging times. So we're going to have to wait for the data, and that's what's going to drive our decisions. Other provinces are making decisions based on their data. We'll make decisions based on ours. And the Premier spoke to this last week. We'll watch the data very closely. But if the numbers are coming down and we're seeing those trends in Ontario, but we need to see it here, then we can start talking about reducing restrictions. But again, right now, at this point in time, we haven't seen that trend line. So, as I said before, Rick, there is light at the end of the tunnel, and if we follow the patterns of other provinces and other jurisdictions, we may be able to do that. But our focus for right now should be supporting our healthcare workers, continuing to follow the measures that are in place. Get your booster shot if you haven't or got your shot already, because it not only provides help through getting through this wave, but for future waves. That should be our focus right now. But we will be talking about going, as we watch the trend lines and understand if we are in a downward trend, about when and how we're going to ease restrictions.
Thanks, Minister. We'll go to the next caller, please.
Carrie Tate, Globe and Mail.
Hi, Minister. Thanks for taking my question. I'm wondering how you feel about one of your caucus colleagues supporting and participating in the protest at the southern border. This is a protest against policies out of your ministry, and it's not just a policy skirmish. This is an international border. How do you feel about that?
Well, I think our government position on this is pretty clear. Even though we respect the right of people to protest, blocking highways is illegal and is against the law. So in terms of the choice, I don't agree with my colleague's choice. Our government, quite frankly, is focused on and urging those involved in the protest, who are involved in the blockade, to cease the blockade. That has an impact on Albertans, an impact on business, and quite frankly, isn't the right way to protest.
Thanks, Minister. Carrie, follow-up?
I'm good.
Okay. Thanks, Carrie. So I think we have time for two more questions. Operator, will take the second last question.
Erica Rowling, Trending 55.
Okay, we don't hear you. You may be still on mute.
Hello?
Okay, I can hear you now.
Awesome. Thanks for taking my question, Minister Copping. I am just wondering, this is about rural doctors. There is a lot of doctor shortages up in rural northwestern Alberta, specifically McLennan, Lacrete, Fort Vermilion, High Level, Fairview, Manning. There's been multiple closures in the area that I broadcast. Is there going to be any retention for places that you haven't already mentioned in the near future?
Yeah, so there's work going on across the province. The reason why we picked these locations, they are the most acute need at this point in time, and this list isn't final. We'll be adding to this list, and this is just this program is targeting 20 doctors a year. We are doing significant amount of work across the province in terms of trying to recruit and retract, using pulling the immigration lever as well. AHS has sponsored a number of docs across the province to be able to have newcomers be able to apply, get sponsorship, and then get through the process. So this is just one part of a larger approach. We recognize that there's shortages across the province, particularly with family physicians. This is one aspect of it, but we'll be looking at, potentially, if some of those other areas are more become up the list in terms of acute need, they can this program, the Reside program, may apply. But we are still doing a number of other programs to try to attract and retain physicians across the province.
Thanks, Minister. Follow-up?
Yeah, I'm just wondering, the 3-year retention that you guys are talking about, are you hoping for longer in these communities? I know that where I am is very rural compared to the bigger centers like Edmonton and Calgary. The closest rural centers would be Grand Prairie, Peace River. For most of these places, that's about 2 to 4 hours away.
Yeah, the short answer is yes. We know that there's some good data that once individuals actually move to a location and they settle down and put roots there, they tend to stay, and maybe not necessarily on that location, but they tend to stay in that type of practice. But there is some data on it, and maybe I can ask Dr. Parker if you'd like to comment further on this.
Yeah, thanks for that question. And I think this is really kind of the gateway opportunity to get people into the community. And we know, as Minister mentioned, from our own data from our PAP, that the earlier and longer you can expose rural physicians and all rural healthcare providers in a community to that type of practice, they're more likely to want to continue in that type of practice. I know that's certainly been true for a lot of the medical students and residents that we've welcomed into our communities, and that's a very vibrant program that we support as well too. And I think this is just one other piece of facilitating and removing perhaps some financial barriers. If people have the worry, as Minister mentioned, to set up a practice, if we can help them overcome some of those initial financial challenges with establishing themselves in rural Alberta, I think this will be a great help.
Thanks, Dr. Parker. So with that, we'll move to our final question.
Dan Singleton, Great West.
Hi, Minister, for taking my question. The lack of rural physicians has been a problem for some time, ongoing problem. Is it now at crisis levels where you need to be addressed at light as a crisis?
Thanks for the question. We are continuing to let me back up. This is an issue that's across the country. We here in Alberta, we still actually have an increase overall in terms of the number of docs. If we looked at last year, December last year to December of the year previously, we had an increase in 33 doctors overall in the province. We have, of course, doctors moving out and doctors moving in, so the net increase is 33. That said, we've had challenges in terms of attracting and retaining in rural areas for some time. We know that we need to address this, and that's why our government has made a commitment, $90 million this year, and this program is part of that to be able to deal with the issue over the next 3 years. Plus, we will actually be looking at other ways to be able to ensure that we can have an ongoing supply of doctors into rural areas, because we recognize the challenges of people changing their practices, and we need to highlight not only the opportunities, but as Dr. Parker has said, is once people are exposed to rural areas, you expose new doctors early, and a system is setting up their practices, they can do so and provide the services that Albertans need.
Thanks, Minister. Dan, a follow-up?
Yeah, you're talking about other avenues of bringing physicians in. Does that include from out of province and out of country?
Yes. So it's, as I indicated earlier, AHS is sponsoring a number of physicians. So, for example, in Lethbridge, there's a number of physicians where we have challenges and family physicians. We are sponsoring, so this is, and by actually establishing the sponsorship, foreign trained doctors can come in and go through the accreditation process, but we're also welcoming doctors from across the country to be able to come to Alberta and make sure that we can attract and retain them.
Thanks, Minister. And Dan, we'll wrap it up there. Thanks to the Minister, Dr. Parker, Katrina, and Hayden. As always, sorry if we didn't get to you on the line. Reporters, feel free to follow up with me or AHS or RPAP as appropriate. Thanks all.
Thank you.